We are good.
Okay, good evening, everyone. Welcome to the December 8, 2022 meeting of the Community Board Health and Human Services Committee. My name is LV Barroso, and I'm the chair of the committee. This meeting is called to order at 6:33 p.m. Tonight, we are joined by Assistant District Manager Brendan Burt. As a reminder, New York state law now requires all community board members to have their cameras on and their first and last names displayed from the time the meeting is called to order until the time the meeting is adjourned. If your camera is not on and your name not properly displayed, you cannot count towards quorum. Members of the public, you can raise any questions or comments that you have through the Q&A feature of Zoom. If there is time following the committee's discussion, we will field questions from the public. Raj will take minutes tonight. Thank you so much, Raj. And we will now take attendance by roll call. Brendan will conduct the roll call.
Committee members, I will call your name and you will unmute yourselves. When your name is called, please say present. I will announce if there is quorum. Marty Barrett. Okay, I do see Marty here. I know he's had a little bit of technical difficulties.
Present.
Okay. LV Barroso.
Present.
Okay. Jason Fromowitz will not be with us tonight. Sadie Howard. I do not see Sadie here, so she is counted as absent. Sandra Leftoff. I also do not see Sandra here, so she is absent. Rich Mitz.
Present.
Raj Nayar.
Present.
Aisha Siddiqui.
Hi, I'm here.
Hannah Singleman.
Present.
Gabe Terzo.
Present.
And Ronnie White. I do not see Ronnie here, so she is counted as absent. But we have a quorum.
Good. The agenda for tonight's meeting was distributed ahead of time. The agenda for tonight's meeting was distributed ahead of time by the board office and is reflected on the screen before you. If there is no objection, we will adopt the agenda. Members of the committee, if you object to adopting the agenda, you may raise your hand through Zoom. Seeing no objections, the agenda for tonight's meeting is adopted. The minutes from the November 10th meeting were distributed ahead of time by the board office. If there is no objection, we will adopt the minutes as drafted. Members of the committee, if you object to adopting the minutes, you may raise your hand through Zoom. Seeing no objections, the minutes from the November 10th meeting are adopted. They will soon be available on the Community Board 6 website. In order to conduct an efficient meeting, let's observe a few ground rules. No one may speak until granted the floor. Committee members, if you have a question committee business or wish to make a motion, please raise your hand through Zoom. The chat function should not be used for committee business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information that was already stated aloud on the record during the meeting. When a committee member is given the floor to speak, I will identify you and you can unmute yourself so that you can speak. Committee members are required by the state open meetings law to have their Zoom cameras on and your first and last name displayed during tonight's entire meeting, from call to order to adjournment. If you must step away from your computer briefly, you are required to leave your cameras on. The order of the adopted agenda should be followed. So tonight's agenda is about planning for the spring 2023 Community Board 6 Health Fair. Brandon, can I share my
Yep.
slide?
Yep, you should be able to share. You should have permission to share your screen.
You can see it?
I don't see it right now. You need to click on share screen at the bottom. And then select what you want to share.
Okay. Can you
Okay.
see it?
Now I can see it.
Okay. All right, so we only have about, so if we are planning for this community, for this CB6 Health Fair next year, we have about 6 months or more to prepare. So we can start discussing tonight. And so I drafted all of these, but it's each member can make comments and we can improve. So the theme is about health and wellness within the reach of members of Community Board 6. And the goal is to support the health and wellness of residents of Community Board 6 that include the young and older adults by increasing knowledge about health services and resources available in our community. So what do you think about the goal? Does our goal address, do you think, the needs of our community?
Can I ask a question?
Sure.
So who do we think the audience is? I've never attended something like this, so I don't know who comes.
Oh. So the audience for this health fair would be the young and the older adults. The last time we had health fair was in 2018, Brandon, or 2019?
So it was in 2019, but that time around it was more specifically a senior resource.
Right. So that one, the last time we had was 2018, but that
2019.
was 2019, but that was geared, or that was catered more for the seniors of
Okay.
the community. But this time we want to include the young adults, not just the older adults.
Okay.
I see Marty's hand is raised.
Marty? Yes, Marty. Please unmute.
There, yeah, got it. not children, not that I have children, but if this is done during the day, for instance, young mothers and children would be more likely to come.
Yeah, we can probably include children because we're going to be inviting some vendors, and we can also have COVID testing and COVID vaccination in there.
So
So
it would be
we can
all
add,
it would be everybody from CB6. Yeah,
right.
not
So,
just young and older adults.
so should I take that out? So should we say just residents of Community Board 6?
You could just say all are welcome because people out of CB6 might just be like they're not living in CB6.
I agree, sure.
It's true, but our focus is towards our community. We cannot accommodate everyone in the city. You know,
You got a point.
this
too.
is a Community Board 6 focus, the communities within the Community Board 6.
Yeah.
I mean, we don't want to limit, but again, we also don't want to open it to just everyone.
Are the vendors going to be vendors within our community district? Because if it is geared towards,
Yes.
who are the service providers here? Yeah, I can see why we're trying to just include only those in our district. Because
Yeah.
certainly other people wouldn't travel over to ours for the services. They should be able to get comparable services within their districts.
That is a very good point, Raj. Yeah, I have a list of the contacts that we had from 2019, and I'm gonna share it with you. But we can, we have to first finalize our goals and objectives.
Yeah, so just taking out the young and old would work.
Okay.
Mm.
Okay.
So
Okay, so-
providers and vendors who had participated a few years ago. So there's a base for which to start this.
Yes.
Right.
All right, so our objectives are to provide health education information about good health, preventive medicine, and raise awareness of health risk. Second, to promote and provide health services and resources available in the community. Third, to conduct health screening, vaccination, first aid, exercise, fitness, cancer prevention, weight management, nutrition demonstration, dental health, mental health, rehabilitative services, smoking cessation, hearing test, and emergency preparedness. So anything in here that you think should be added?
You covered everything.
Any addition that you think we left out?
Vision.
Vision.
You have hearing tests, but no vision tests.
That's right. So I'm gonna add out where is the hearing? Hearing test, vision. Yes, very good. Anything else?
Blood pressure service. You sometimes see people in different affairs with blood pressure machines, so people could see if they have high blood pressure.
That's included in the health screening, the blood
right,
pressure, the blood sugar, finger stick. Yeah, and also TB, tuberculosis screening is also included in there, including HIV. And what else? HIV.
LV, will bone density tests be available?
Oh, No, I don't think so.
Okay.
That is an expensive one.
Yep.
I don't think NYU will. Yep. The dental, I'm sure NYU will do.
Just a side note, what vaccinations are we going to provide?
We're gonna have COVID vaccination, monkeypox vaccination, flu vaccination, and I'm not sure about RSVP. It all depends upon what we can get.
Maybe HPV if possible.
We'll,
Especially,
Yeah.
you know, if hopefully we'll get young kids, that certainly is
the vaccination,
a
yeah, well,
vaccination that, you know, is
That's-
promoted for you know, tweens and children around that age.
yeah, I'm gonna include that in the vaccination.
Did you say the flu shots included?
Yes, hopefully.
Okay.
Except this is 6 months from now, after the flu season.
Right.
It'd be preventive for the next flu season.
Probably it's too early for the next season, so we'll see what.
So we're talking about what, April? Looking for April or May?
No, we have, I'm gonna show you the. So if there's no other addition in the objectives, we can move
For
forward.
June.
So the prospective location, we don't have yet. So I'm gonna ask anybody that can take the lead on that. So last time when we had the meeting, Jason, Hannah, and Aisha volunteered to be one of the leads. So I'm gonna ask from members who can take the lead on exploring locations. The last time we had it in 2019, it was held at Baruch. But the Baruch room that was given to us, it was small we had about 30 plus vendors that came or participated, and it became small. So if we can explore for a bigger one this time, especially we are accommodating not just the older adults, but including the children and young adults.
What kind of budget do we have in renting a space?
I'm Brendan, how much did we spend last time for renting the room? Remember?
I honestly don't remember. I would need to ask Jesus that because he was the one who ended up arranging a lot of the room logistics with Baruch College, which was we held our senior resource fair in a I think a gym of some sort at Baruch.
Yeah.
But yeah, honestly, I don't remember. And in terms of what sort of budget there is for renting, I would need to
Ask Jesus.
I would need to ask Jesus. One other thing I'll add, just sort of related to the room space topic, is it'll be good to have a sense of what sorts of needs these various tables will have, because we don't want to reserve a room that does not accommodate what some of these tables may want or need to do in order to do what they're hoping to do.
Yes. That's why we are starting early, so we will know which of those vendors are again willing to participate in our health fair. So I just would like everyone to be aware that the last time we did this health fair, It was a lot of work, and it was only Brendan and myself that was working from our committee members. So this time, I would like at least everyone participating in this health fair. And a few of you that's gonna take the lead when it comes to like exploring location and calling our vendors if they are willing to participate in our health fair. So the tentative date that was given to us is June 17, 2023. And the prospective time is from 1 o'clock to 6 o'clock. So that's how many hours? 5 hours. So the organizers is us. And the one that said would like to take the lead aside from myself is Jason, Hannah, and Aisha. Jason is not here, but Hannah and Aisha, are you still willing to take some of the responsibility?
Yeah, I'm happy to support where I can.
Me too.
Okay, good. Okay, so budget, we don't know yet. So Brandon will ask Jesus about that, and the sponsors and the vendors. And I'm going to share to you the vendors. But when it comes to the promotion, we can promote by emails, by developing flyers or poster, by social media, by including our health fair in most of the meetings of the other committees, and newsletter. When it comes to the flyer, the last time it was just us. It's not Brandon, it's just I drafted, and it was.
Before I continue on, I see that Aisha has her hand raised.
Aisha.
Sorry, just really fast. What's the number of people you want to accommodate in the location that we got?
That is a very good question. We don't know. We don't know the number that's coming, especially now that we are accommodating not just the senior, but younger adults and children. So we don't know. But the last time, how many did we have last time? How many attendees or participants we had, Brandon? Approximately.
Last time, I want to say we had somewhere in the 75 to 100 range. Now, they weren't all there at the same time,
Yeah.
but that was how many we had total.
Right,
I
but
would
that was just for the seniors.
Correct. That was just for seniors. However, it was not, the flip side of that was not just focused on health. It was a wide range of resources for seniors, not just health resources. So, given that fact, given these facts, I would say we want to plan for at least 100 attendees, I would hope.
Yeah, 100 to 150, or probably even 200. I would like to aim for 200.
Yeah.
And also, Brandon, that was a good point. We included some, like, was that insurances or getting services like was that home health aid?
I would need to double check, but I remember a number of elected officials' offices were there with
Right.
certain senior specific resources. I want to say the fire department was there, Department for the Aging was there.
Yeah.
And a number of entities that, for a senior resource fair, were very relevant, but for a health fair, unless there's some health specific resource that, say, the Department for the Aging has, might not be the most relevant.
Right.
But Yeah.
Marty? Marty,
Yeah, you really can't look for a room until you have an idea about how many tables are going to be set up. If there's going to be, well, if we're looking to have between 100 and 150 people come over a 6-hour period, that's more or less 20.
Okay, Marty froze there.
but that was a good point by Marty. That's why we can start calling already. But you know, when we planned that in 2019, we didn't even think about the number of vendors participating. We just thought of having a large room, and we were not expecting about 30 vendors participating, but we had I was only expecting like 20, but we had 30 plus. And
Wow.
if we are accommodating, you know, the young adults and children, the more we're gonna get more vendors participating. So
Does anybody have any connections with Epiphany Church? Because they have a really big
yeah,
community room.
I do. I'm a lector and I'm the Eucharistic.
Oh, well,
coordinator
there
of
you
Epiphany.
go. You know,
Right,
from
but
the Stuyvesant Cove Park Association used to have our annual meetings there. It's a really good room.
yes, it's a big one. The problem, the issue is the budget. They
Uh,
are expensive. Just to rent that room, I know it's 1,000 something.
It was 250 when we used to rent it.
Right, the parish hall, I know it's about 1,000, but I will speak to the parish, our parish priest.
After
Wait,
all, we're the community board, and we're doing it
Yes.
for the community and for their parishioners.
Yeah, so I will speak to our head in the Epiphany if they can give us a big time discount.
They should
Probably.
donate it. It's a Saturday after all. It's not, there's no prayers going on.
Yeah, but they have to pay somebody to clean up. Whenever they have a function in there, they pay somebody to clean up. And the electricity, the air conditioning, and this and that. So that's why. But I will find out. Gabe, you have a question?
Just a recommendation. I don't know if anybody has any connections to the Hunter Brookdale Nursing School campus, but the gym's quite large.
That's true, Gabe. I have a connection. I'm a professor at Hunter.
Okay.
That one too. I will find out how much. But that is, yeah, they have a big one too.
It's a big room. It's already it's a training ground for healthcare professionals. So it seems that there's some room for synergy there as well.
Yes. Okay. So we have two already on the list, Epiphany and Hunter. You're talking about Hunter at 28th Street, isn't that the Hunter Bellevue?
Well, I was thinking Hunter Brookdale at 25th.
Yeah, the Brookdale. Yeah.
Yeah, where the early voting is. Yeah.
Yeah, the Brookdale. Yeah, that's where I teach. Okay. Any other suggestion for? So I'm gonna find out for these two, but any other suggestion that can take the lead on exploring some other location?
I can help. Is the church, the Epiphany one, is that on the Upper East Side?
Oh no, it's just here at 22nd. and
22nd and 2nd.
Yeah, I'll take care.
22nd, second.
Aisha, I'll take care of that because the parish priest knows me.
Okay.
But other location aside from Hunter and Epiphany.
The Stuyvesant Town Community Center.
It's not that big.
Oh, okay.
Yeah, it's
You
quite
need something
small.
big, you need something bigger.
Yeah, we need something bigger.
Hmm.
Okay, so I want to share can I do that, Brandon? I want to share the list.
Yes, but you'll need to go to that document. Yes, that's the one.
Okay.
Now, the one caveat I will add about this before Alfie speaks, actually, this was the spreadsheet of invitees that that we had for the Senior Resource Fair back in June of 2019. Given that this was from 3.5 years ago, some, if not many, of the people listed here are no longer there. So I will add that little caveat.
Yes, that's true.
But the organizations will be there. There'll be people who will have replaced the contact people, for instance,
Yeah,
but somebody will be there.
the organization is still there, except the contact may be new.
Yeah. So, in a case like, NYU, I mean, of course they're still there, but Michelle Avila, I don't think is with them.
So how many do we have on the list? I can't see it.
You should be able to scroll down.
Oh yeah. So we have about, wow, it's even, we had a lot. See, I thought it was just, yeah. So on the list, we have about 56. So
They all participated?
Not all of them.
not all
Many
of
of
them.
them, but not
Oh,
all of
Yeah,
them.
I think it's about 30 plus that participated out of this
Wow.
list.
Impressive.
Yeah. We didn't think, I was only expecting about 20 plus, but we had 30 something, probably 35. So can I ask members to start taking some of the calls?
Yeah, I'll participate in that.
Okay, so how do we do this? The first,
Email me the list.
okay, so Marty, you want to take the first, probably first 8 on the list?
I was thinking 15, but okay.
First 10. And
Okay.
I'm gonna ask other members. Brendan, are you?
Yeah, I just wanted to quickly also point out one other caveat, which is that since this was not health specific, there are some organizations on this list, like I saw Con Edison on there,
Right.
that aren't necessarily going to be relevant for a health fair.
Yeah.
So the committee is welcome to go in that direction, but I would also encourage committee members to use a little bit of discretion, because there are some organizations on this list that won't, unless there's something I'm not aware of, won't be particularly relevant for a health fair.
And we should not limit on this list. If you have any, if you know of any organization that is willing and that would be relevant to our health fair, please. Okay. So any volunteer for the next 10? Marty is taking the first 10. Any other volunteers?
I'm happy to volunteer to reach out to people. I'm curious though, do we have standardized language we're using? Should we have some degree of specificity about what the kind of final product is going to look like?
Yeah.
Or are we just sending out feelers?
That is a very good question, Gabe. So that's why we have a theme, we have a goal and objectives, and you can say all those objectives.
Okay.
And we have a date already. We just need to say to them that we'll get back to them if we have already the exact location. But most important is the date. Because, you know, June, that's when most of summer activities are happening. And if we don't tell them about the date ahead of time, they would say, oh, I'm sorry, we have already signed up for another activity. So most important is to give them the date and to reserve that date and time for us.
And it's a Saturday
And it's a Saturday. So, you know,
in the summer.
yeah. That's why we need already to start calling some of these agencies.
Okay. Can I recommend a shared Google Doc, a Google Sheet where we could kind of put in, the most recent, like what we've done and where we're at. So, I emailed X, Y, and Z, or trying to find a contact number or something like that we could all
Yes,
be shared on.
absolutely. Yes. All right. So the first 10 is Marty. The second 10 is Gabe.
Yes.
Any other volunteer? Hannah and Aisha?
Yeah, I can take the next 10.
Okay, the next 10 is Hannah. Raj, you have a question?
No, I'll just take the following 10.
The following 10 also is Raj. And did I hear Aisha?
Yeah, I can do the next 10 after
Okay,
that.
good. So I think we're all set. Thank you so much. Okay, so I think that's it for now. And so we can probably, yeah, we can share by Google Doc. Yeah. Okay, so I'm gonna stop the share.
Elby just wanted to quickly flag something that was typed in the Q&A from from Ashley Zhu. I apologize if I'm not saying that correctly.
Okay.
A nurse at NYU Langone, who says that she's more than happy to make connection to either schools to offer health services. Please let me know if you all would be interested. And Ashley's name is, well, Ashley's email is included there as well.
Is that from the public, Brenda?
Yes.
Okay.
But she's also affiliated as a nurse at NYU Langone.
Oh, that's great. Okay, any other suggestion about that health fair that we're planning?
I guess one thing I will add is, as you all hear from organizations, please let the office know.
Oh, that's right.
Just because that will give the office a sense of how large of a room are we going to need for this event. This has been alluded to multiple times, but with the senior resource fair back in 2019, it was a bit of a tight room for the number of organizations that ended up being involved, especially since there were 2 or 3 organizations that didn't confirm until the last minute, which
Yeah.
we hope to avoid this time around. That's part of why we're starting to get feelers from organizations now.
The office will be responsible for all insurance certificates. Some vendors might want insurance certificates. Certainly the venue will want an insurance certificate.
Yeah, I would guess. I'm not an expert on such things, but I would guess.
Well, I've done it a number of times in renting places for different events, and certainly a certificate of insurance is always required. So it might be something that you should talk to Jesus about.
Right.
Yeah. Yeah, I can ask.
Yeah. And do not forget about the budget. How much can we spend when it comes to renting?
Yeah, I'll ask him that as well.
Okay, so should we go on with the rest? Okay, so about my report, I have a short report. The Youth and Education Committee is taking the lead on the issue of illegal pop-up smoke shops selling cannabis that are bad or weed that are dangerously tainted. So most of those shops are operating with no license and located in less than 200 feet of school premises. So our committee, as well as the Bureau of Affairs and Licensing, will also join in addressing this issue. And we will participate in developing a RESO if needed to include the health effects of such products, most especially to the young kids. So I would like to ask members of the committee, anybody who wants to take the lead on this issue.
We don't know who has licenses or not.
Brendan? Do
I
we
will
know?
say, one thing I will say is, at this point, if they're selling cannabis, you know, even to this point, they do not have a license.
Right, it's just January 1st, but there are, 36 licenses that were granted, I think, just in Manhattan.
Yeah, but I don't think any of those places are actually opened yet. So, at this point, I would say if they're open and selling cannabis, they don't have a license.
So what would taking charge entail?
You mean to say the one that's volunteering to take the lead?
Yes.
So what if writing a RESO is needed? So, you know, the ones taking the lead can participate in writing the RESO. But you don't have to worry, I'm here. I mean, it's just that, you know, we want members to be active in participating in most of our projects now. So it doesn't just fall on my lap.
If you can help me, I'll do it.
Yes, of course.
Either way, yeah.
Okay, thank you, thank you.
Email me so I remember.
Yeah.
Thank you.
And any old business? Any member of the committee that has old or new business? Okay, if there is none, we can adjourn the meeting. And I would say happy holidays to everyone. And thank you so much for all your support in all our activities. And we will hear from you about updates on the health